I'm joined now by our medical expert, Dr. David Winter from Baylor Scott and White Health. Good morning to you, Dr. Winter. So, okay, just tell us about it. Give us the news. What is up with this new variant of interest?
Well, there's a new kid on the block, that's for sure. Now, the predominant strains in America and around the world are still BA4, BA5. So this is brand new. Doesn't look to be more contagious, doesn't look to be more dangerous as of yet. We need to keep an eye on it. We don't know a lot about this one quite yet, Sonia.
Okay, and Dr. Winter, you and I have talked about this new bivalent booster. It was promising, right? A lot of people were interested in getting it, but how hard is it to find at this point? Because some pharmacies are apparently already reporting shortages.
Yeah, I haven't seen that in North Texas yet. No reports about that, but Moderna's apparently in short supply in some areas. They're pushing to get more out. There's plenty of Pfizer out there, we're told. Most of the major pharmacy chains have these right now. As far as who should get this, you know, I want to make the analogy to influenza. Every year the influenza the virus changes, it mutates. A new vaccine comes out that targets that. We're seeing that now with coronavirus, with COVID. So I think we're going to get a new one this year, and the next year will be another one and another one. So I think it's the new normal. We need to get a flu shot and a COVID shot every fall if you want to keep yourself well protected.
Yeah, good reminder about that flu shot because we are coming up on flu season right now. Dr. Winter, there's new guidance out that all adults need to be screened for anxiety when visiting a doctor. So how and why did this become a recommendation?
Yeah, the new report that I've just read, Sonia, is that 42% of Americans have some anxiety in their adulthood. This is surprising to me. Don't see this much. What the U.S. Preventive Task Force is trying to consider, they haven't passed this yet, but they're considering to make this another recommendation for screening. So we ask patients about depression. We get them screened for colon cancer, breast cancer. Maybe you ought to screen them for anxiety also. Hasn't been approved yet, so we'll see what the U.S. Preventive Task Force says in the coming weeks.
Yeah, this is a big conversation in pediatrics too, screening kids for things like this and mental health. So when it comes to cancer deaths, total cancer deaths in America, there's been a steady decline over the past 2 decades, even more so recently. So, Dr. Winter, I'm wondering, do you attribute this to screening, research, early detection, a little bit of all three?
Yeah, a little bit of all that. This is really, really good news because cancer deaths have declined significantly in this country. Not all around the world, by the way, but in this country, we're screening more people. For example, we know if we catch an early colon cancer, early breast cancer, much easier to cure that than when it's late stage, so screenings are important. A lot of new drugs are out right now. You see these on the advertising, on the media, TV, a lot of new drugs, and they work very, very well in many cases. And then we found new ways to treat the immune system, make the immune system a little stronger. So 3 different ways we're fighting cancer, and the results are working. This is actually science in motion, and I'm delighted to say we're making good progress there.
Yeah, our privilege certainly shining through here in this country. And finally, Dr. Winter, a new study suggests adequate sleep improves our immune system. Less than adequate sleep impairs our immune system. Look, I think a lot of people hear that and go, yeah, I could have told you that. I feel that, right? Tell me more about this report.
It does make sense to me. It makes sense to me too, but it's an interesting study. So they took people who agreed to be sleep deprived for 6 weeks. They did blood samples before and after, and several different cells in their blood changed. These are the cells that influence your immune system, make it stronger. And they found that they got weaker actually when you were sleep deprived. So this study needs to be confirmed with other studies, but it makes sense. Sleep is definitely good for you, Sonia.
All right, Dr. Winter. Well, it is good to see you. I hope you get some good sleep this weekend. Thank you as always.
Great, thank you.